Well, thousands of Syrian refugees are expected to leave Turkey and head home temporarily. Many are trying to find missing family members. Russell Serda has more from the border between Turkey and Syria.
The Turkish-Syrian border, Zeytindale border crossing, and not far away from here, just 10 kilometers away, it is the town of Jinderes inside Syria. It is one of the worst hit towns in the northwest Syria. More than 1,000 people have died in the earthquake, and so far in the northwest of Syria, there are 7,800 people that died, and many of them are still missing under the rubble, and 150,000 people are displaced here. So Jinderes, El-Tarib, Amarnaz, Salkin, particularly these places were the worst hit. And now the aid convoy is quite late. However, through the last couple of days, they have stepped up their efforts to get the aid, to deliver the aid to these much needed places. I have talked to some of the Syrians. They are quite sad and angry. They say we have been forgotten by the international community, that they didn't receive the proper equipments, proper aid, food, and they are suffering from the lack of electricity, lack of the heaters, and the water as well. These are the essentials in these much needed places. So I have talked to one of the Syrian rescuers here. He said that particularly during the first 3 days, they were just working with the rudimentary equipments, and they didn't have any digger or excavator or heavy lifting machineries. They were almost working with their bare hands, and they said if they had the modern equipments, they probably will be able to save thousands of the lives here. However, that is the situation in Syria. So these areas northwest of Syria has been heavily bombed by the Syrian regime for over 12 years of the civil war. Many of the houses and the towns here are already heavily shelled and damaged or cracked. And the people, Syrians, have built makeshift homes and the camps here. It wasn't too much, but still, it was home for that. However, this earthquake has taken that also from them. So disaster after disaster for Syrians. And while we were crossing the border here, we have seen hundreds of the Syrian families that are trying to pass the border to go inside Syria and to find their relatives or to join their funerals. These Syrians have made Turkey a home for themselves over the last decade, and now they have been hit by the earthquake, and inside Syria, they have thousands of their relatives. They have lost hundreds of their beloved ones. Now they're trying to pass the border and to join their funerals or to meet up those who survived.
All right, let's get the latest situation in Antakya. Natasha Ghanem is there. Natasha, tell us what you've been seeing.
I'm in a tent city in Antakya. We've been following around 2 clinical psychologists who are meeting with earthquake survivors. 13.5 million people across the south were impacted by this earthquake. They are facing myriad forms of trauma. The trauma of losing a loved one, the trauma of losing a home. And that is why the Turkish Red Crescent has deployed teams across the south to offer much needed mental health services. We're joined by Aisha. She's one of the clinical psychologists we've been with today. Thank you for joining us. I know these are such difficult days for you. Please tell us what you've been hearing and witnessing in the camp since you've arrived.
We have been here since the first day of the earthquake. Like, as TRC colleagues were on the field, like we are still on the field working as a psychological supporters. We are mostly doing psychological first aid to the people who are facing with this disaster, with this trauma. Most of the people are having anxiety. I mean, their levels of anxiety so high. So we are firstly doing here, like observing people and then listening them and then linking with them. So this is really important for them to be listened, to be understood by people. So we are taking responsibility here just to help, just to reduce their stress levels. We are afraid that after some time they would face with PTSD, post-traumatic stress disorder. these are the cases that we are facing. Some of them are waiting for their relatives from the rebels. So this is really a huge problem that we are facing.
We're seeing so many children, and it's obviously heartwarming to me. I was having issues with the microphone. It dropped, and a beautiful little girl right before the live came up and gave it to me. So there are moments of children smiling and playing, but obviously we're also seeing a lot of children looking shell-shocked. What are you hearing from children, and what should we be especially aware of when we talk about the needs, the mental health needs?
Most of the children are neglected here, as we observed, because their parents, their relatives are, facing with this issue. So they are also traumatized. Emotionally unresponsiveness we are also facing with these children. They are in shock. And some of them we are like trying to play games, in these ways to express their emotions. And also some of the children are repressing their emotions. So also this is not a normal situation. So we are trying to help them to be in a normal way, in a healthiest way, to express themselves.
There is clearly going to be a kind of collective trauma here in South Turkey. What kind of behaviors and how do you, going forward, do you expect to see, and how do you think it's going to affect the fabric of society?
For the future, you mean?
Yes.
We would be facing with the PTSD, post-traumatic stress disorders, after 6 months maybe. There are really lots of things to do here, like in a psychological way, is in a basic needs, because for psychological first aid, it also means like giving someone blanket, giving someone water, but for the future, to make them a shelters, for them to be, to be resilient, to be adapted to the future.
Thank you so much for the work that you're doing, and I know these are difficult days. They're not going to tell you, but these workers have also been sleeping in cars and not showering and will face a kind of trauma as well. The president of the Turkish Red Crescent told me, despite the services that they are providing now, that they are, quote, humble compared to the enormous need going forward.
Yes, extraordinary work. Natasha, thanks very much indeed. Natasha Ghanaian reporting. Now, Al-Assad Beg is also inside a makeshift camp in Idleb.
They have tents, some of them have heating, many of them don't. It is bitterly cold here. There's a constant smell of burning in the air, not only at this camp, but across the city of their burning wood, paper and plastic. But there is aid getting in. So if I can get Volkan to just show you, people are lining up to get their afternoon lunch. Now, there are meals provided several times a day to people here. There's water tanks that come in, there's trucks that take away the rubbish, but there is a fear that because of the lack of sanitation and people living so close together, that there will be a spread of disease. But at least there's one thing, that there is clothing, there is food getting in, but the other daily tasks are very difficult, like washing the children's clothes, washing dishes, things like that, because of the cold temperatures, are extremely difficult for people. Now, elsewhere in the city, they are taking away the rubble, and we saw the municipality workers out on the street cleaning up those streets. But there is a real concern about what happens next. What happens when all these people that you're seeing here have stayed in the tents? When do they return to their homes? What's happened to their homes? When they demolish them, when are they going to start rebuilding? President Erdogan has said that they will rebuild in a year's time, within a year. But that's still a huge task. It's a vast area that has been affected. And for these people, they can't remain here for long. It's bitterly cold and they are struggling even though aid is getting in. So now the question remains for the government and the authorities, how do they get people out of these tent cities and back into homes?
All right, let's now speak to Dr. Zahid Al-Masri. He's the CEO of Physicians Across Continents, also head of Med Global's mission to Turkiye and Syria, and joins us now from Gaziantep. So welcome to the programme. Now, you have been in Idlib and Aleppo in Syria for the past 5 days or so, I think. Just give us an impression of what you've seen and what's required most.
Yes, hello. Actually, after all these 12 years of suffering in this area, and we have this earthquake now, it's very obvious that the people in this area are in need of everything now. The minimum evaluation of the situation said that at least 70,000 are in need of urgent shelter. It doesn't mean that the others are in a good situation. It's the winter weather and the temperature is below zero at the evening. It's very cold now, and people actually are suffering and they are lacking all the needs for their normal life. Of course, in relation to the health situation also, large number of trauma cases are now in the hospitals, and the humanitarian staff in different NGOs are working for the last almost 9 days with no stop.
So in the first instance, it was all about dealing with trauma, as you say, and that's still going on from the earthquake itself, from the actual event of crushed limbs and so forth. Now and going forwards, what will be the medical priorities?
Yeah, most of the trauma cases received by the hospitals, they are treated as a life-saving intervention. And now most of them, they will need a second intervention for the definite treatment, like, for example, internal fixation. On the other hand, hospitals already are suffering, and we are concerned about the safety and the health of the elderly people, of the children, of the patients with the chronic diseases. For example, patients with chronic renal failure, chronic kidney failure. They need continuous dialysis sessions, and these centers are affected now, and their capacity decreasing, while the number of patients actually is increasing. So we think that the whole health system, which already was fragile before the earthquake, is going to be in need of support in all of its levels, not only the trauma cases. We are also concerned about the issue of outbreaks. As you know that we have cholera before that in this area in Syria in the last year, and the cholera outbreak was still there when the earthquake happened. So we are concerned about the safety of water supply for these people and the possibility of increasing number of cholera cases.
You summed it up, didn't you? Capacity decreasing, the patients increasing, and given the widespread damage, to say the least, that we've seen right across the board, it's hard to imagine how you're even beginning to be able to treat patients in the numbers that are required.
Yeah, we started to deal with the life-saving intervention. I mean, patients with the trauma and things like that. You know that within these days, most of the chronic disease patients are not even consulting health facilities. They are just concentrating on their safety at home, or if they are actually outside in one of the temporary collection centers. So most of these patients actually are in need of support now. And in the next stage, we are thinking about activating large number of mobile clinics to visit the patients at their camps and at their villages, and trying to help them while they are still there. Because we are expecting that most of the patients will not be able to access the fixed health facilities in the next few weeks.
Right. I mean, of course, this isn't just a short-term problem, not even a medium-term problem. It's going to stretch a long way into the future, certainly into the summer months. The displaced will still be displaced then. What are your concerns about the ongoing requirement for medical care?
Yeah, we are in the winter, and we are concerned about the diseases related to the winter weather. But now we are going to the summer again, and with all this destruction and with all this deficiency in the infrastructure, we should think about the next summer, about the possibility of outbreaks, about the increased number of cases of cholera, and we should plan for that starting from now. Also, we should think about the mental health of this community who are affected by this catastrophic situation. We should provide them with psychosocial support. And of course, we should rehabilitate all the health facilities and support them for the long-term use.
We'll leave it there. We wish you well with all your efforts. Zahed Al-Masri, CEO of Physicians Across Continents. Thank you.
Thank you.